Hello everyone, today we are going to talk about spinal stenosis. There are many diseases of the spine. Some of them are simple and some are serious and affect movement and sensation. One of these diseases are spinal stenosis. Spinal stenosis is the narrowing of the spaces within the spine, which eventually result in pressure on the spine cord and nerve roots. No doubt it's an interesting topic. After watching this video, you'll be able to know everything about spinal stenosis, its causes, symptoms, and how it can be diagnosed and treated. Our role today is to answer most of your questions regarding spinal stenosis. Today we have Dr. Lee, who is a leading doctor at Bundang Jeseang Hospital. He's going to discuss with us everything about spinal stenosis from an experienced medical point of view. I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Dr. Lee,
hi.
Nice to meet you.
Nice to see you.
So before we start our questions, can you please introduce yourself to our viewers?
Hello, I am Lee Young-sang, who works at Bundang Jeseang Hospital. My major is a spinal field. Most of the spinal surgeries that have been performed so far are hydraulic surgery with iron in the waist and hydraulic pressure. Since 2006, I have been specializing in iron-free, non-pressure surgery in more than 90% of the patients. Of course, the results are very good.
Doctor, straight away to first question, what is stenosis?
It literally means it's narrowed. A disease that shows characteristic symptoms due to the narrowing of the nerve called the spinal canal is called a stenosis.
What are the early signs of stenosis?
The biggest feature is that you have to walk and rest in the middle. There are no symptoms when lying down or sitting, but you start to feel severe stiffness in your hips as soon as within 5 minutes or 10 to 20 minutes after you start walking. And resting while walking, and walking again, is the characteristic of this disease.
What are the exact medical examinations needed to diagnose lumbar stenosis?
We basically perform x-rays on people with symptoms of spinal stenosis, but the most important thing is MRI. When looking at the results after MRI, if surgical treatment is needed, spinal angiography is performed to put medicine in the waist. When looking at the patient's standing posture, if there is an issue in the spine, it may be necessary to solve this problem. Therefore, this test is also one of the most important tests.
We talked before about first symptoms. Now I would like to ask you about if there are any severe symptoms that comes with stenosis.
Symptoms usually improve as the patient lies down. Paralysis rarely progresses, but if it becomes very severe, the function of the bladder or the anal function may deteriorate. But this case is very rare. The big feature of spinal stenosis is that it is difficult to walk and to rest in the middle while walking.
Alright, so moving on to the treatments. What are the treatments out there for stenosis?
There were no drugs in the past, but some of the drugs that came out recently include drugs that increase blood flow to the spinal nerves and make blood flow well. Take the drug 3 times a day. Take it for at least 2 to 3 months, and if the condition improves, continue treatment with the drug. Surgical treatment is performed if symptoms do not improve, even though physical therapy is performed at the same time after taking the medicine. There are many types of surgical treatment, and if the spine is metastasized forward, surgery to fix it with a screw is sometimes recommended. However, as I said earlier, I know that the results are good enough even if you perform surgery without iron for more than 20 years. Some people have objections to this, but the data I have published so far show evidence. The place where I learned how to operate is Hiroshima Hospital in Japan. In Japan, each city has a very different surgical method. In all regions of Japan, surgery to fix with screws is performed just like in Korea. However, in the city where I was, it is said that since the 1980s, efforts have been made to save the original spine without iron. And I happened to learn how to operate with good opportunity.
So at what stage is surgery recommended?
As I said, if the drug treatment does not improve after more than 2 months of medication, physical therapy such as back muscle strengthening exercise and cycling will continue. Nevertheless, if it does not improve, it will be subject to surgical treatment if it is inconvenient and the quality of life decreases.
Okay, all right. After the surgery, how often should the patient come to the hospital and get checkups?
In some cases, it reoccurs after surgery. Reoccurrence is less than 5%. If you visit the hospital after 6 weeks after surgery, you don't have to come after that.
So, we talked about recurrence. How often does it happen?
It's less than 5%.
Under 5%. Okay. So, does alcohol and smoking affect stenosis?
The influence of alcohol is not significant. Cigarettes themselves reduce blood flow, and frequent coughing caused by cigarettes can worsen back pain, so it is recommended to avoid cigarettes.
All right. One last question. How can a person prevent lumbar stenosis?
There are two types of spinal stenosis. The first is when the spinal canal is narrow from birth. They have symptoms since they are young, so there is no way to avoid them. The second is an acquired problem, and spinal stenosis due to degenerative changes is the most common. In this case, a method of preventing the joints from deteriorating should be implemented. However, the method is impossible because it is the same as finding a way to not get old. Since spinal stenosis is a disease in which vertebrae and joints become poor, the way to improve it is constant muscle exercise. Lumbar muscle exercise affects the lumbar spine. Upright muscles or flexor muscles and strengthening muscles through steady exercise can prevent deterioration of the condition due to degenerative diseases. Steady swimming or cycling exercises are good. Swimming is better for freestyle than butterfly or equilibrium. Unusually, walking exercises cannot be done because you cannot walk for more than 10 minutes, but cycling is possible all day. Therefore, this exercise can slow down the rate at which symptoms worsen. However, there is no way to fundamentally eliminate and prevent the disease. Thank you.
Thank you so much, Dr. Lee.
감사합니다.
Today we learned many things about spinal stenosis, and the doctor explained in details everything related to this spinal disease, such as motor and sensory symptoms, as well as how we can be diagnosed and treated. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and respond to you as soon as possible.